In 1992, the year we were born, AIDS was the #1 cause of death for men between the ages of 25 and 44.
Yeah. Wow.
That is wild. Hello, everybody. We are back for another episode, and I am actually pretty excited about it because today we are talking about health. I'm excited because this is kind of the world I live in.
Yeah.
As it relates to healthcare, the healthcare system, everything that I do in my healthcare administration job, as y'all now know from 3 episodes ago, sometime this past season.
Right.
When we talked about work and what we do. But how you doing, Kendrick?
I'm good. I'm nervous. Yeah. I'm probably more nervous about this episode than any of our episodes before.
Why?
I think because there's so much about healthcare and how it affects gay men that is misconstrued,
Yes.
or even a lot of misconceptions. And I want to make sure we get it right and that we're able to tell these stories, tell our personal stories, but then also tell about the struggles and triumphs of our community in a way that is not amplifying some of the misconceptions that we see on this topic. So I'm a little nervous.
Yeah,
so as we're talking about this,
we're going to be learning.
Yeah, we're going to be learning together. I think some of us too, there's not a lot of language for some of the things that we're going to talk about.
There isn't.
And trying to figure out what is the correct, because even while we were planning, there were moments where I was like, Jake, is this the right way to say this? Is this the way that you should be saying this? Because what we don't want to do is dehumanize what we're going to talk about, because healthcare is so personal to you, as in like life and your career. But then for both of us, I feel like we're very health conscious.
Oh, very, very. And as a little caveat for today, we are not physicians. We're not providers in any sense. But we're definitely talking from our lived experiences as gay men. I think to what you're speaking about like the HIV epidemic that has happened, that is continuing to happen. But then also like in the Latino community, there's a lot. Yeah. And I'm also anxious / nervous to like talk about it, just because I think both of us want to say it in the most respectful way, but also correct. We want to talk about it in the most proper way that we possibly can, but also just shedding light. There you go. Shedding light on the things that we go through, not only just as gay men, but also being Latino. Right.
And I think that one of the things on that point, I think I wanted to start with the stat that we found that, or just in general, that I think we know about in the industry that you work in, and then me just being sort of health aware, is that we are fortunate that HIV rates are dropping tremendously in the US because of access to different medications, which we'll talk about in a bit. Yep. But for the Latino community, it's actually rising. So
it is.
Especially for the Latino gay community, you're seeing a sharp rise in HIV, which is for a lot of things. I think it's maybe a little bit of machismo that we talked about before, of not seeing your health as a priority, or taking it in and saying I'm good.
That is something I definitely want to talk about later.
Yeah. We can talk about it right now and go.
Well, just like one of the things that when we're, especially as it relates to like my work, I'm going to probably reference it a lot, just because
that's what you do,
because it is. And that's what we're talking about today. But like, as it comes to like even our marketing campaigns or things of that nature, as far as looking at our target audience, we live in San Antonio, 80%, 70% around there are Hispanic. We know we have to cater and we have to market towards females, individuals that identify as women, is who our target population is, just because in the Latino culture, there's men just they're not as active. It's probably, you're right. It's definitely the machismo part of everything is in the community itself, but it's I see it day in and day out.
Yeah. So, and I think we need to hold our elected officials and our, sort of federal government responsible too, because if they're seeing a decline in rates, but seeing a rise in Latino population, why aren't they doing more to provide access to medicines and things that can help? It's not like the 80s, but we wanted to start this episode by talking specifically about the AIDS epidemic, which I think is something that we all learned about in different ways at different times. I think I'm continuing to learn about it, but it caused a lot of stigma in our community and a lot of pain in our community, a lot of death.
Correct.
In our community, because I think, in the early days, it was associated primarily with gay men who have sex with men.
Correct.
And drug users, because the rates of transmission were higher in those communities, and it caused a list of stigmas that we're still dealing with today.
Yeah.
And I think the way that we operate in medical field or in the medical space in general is all a reflection as gay men of what people went through during the 80s.
Yeah. And that's something that even as I mentioned Apollo Wellness, where it's a lot, we focus on sexual health. We make sure that it's LGBTQ friendly as it relates to the culture, the competencies that our practitioner has, that all of our staff have. But it's because like, even when we were hiring individuals, and then whenever we do hire another individual, they have to go through an educational training to understand the history. Because we're definitely like, if you don't understand history, it's going to repeat again. Like you need to make sure we know where we came from, what we're doing, what our goals are, what we're trying to do, how we're trying to make individuals healthy. And to your point, like in the 80s, when it all started.
Right.
Like, I don't want to get too much in the weeds, but like
I do, because I think people need to know.
Okay.
I think people need to know the start where it came from. But also, I wanted to add, what you're talking about though is not mandated, and that's the issue. Is that most organizations are not focusing on that, and
that's that we'll talk about that too. Yeah. more later. More is to come. Mm-hmm. But as it relates to like the AIDS epidemic, it started in 1981, is when it first started to come about, and individuals or practitioners and physicians themselves didn't know what was happening.
It was called GRID, right? Gay related
it was called GRID because individuals that had it were identified as gay, or identified as having sex with other men, men having sex with other men.
Right.
So I will most likely jump back and forth, just because there is it's another misconception that because a male has sex with another male that they identify as gay. That isn't the case.
Right.
So men who have sex with men versus gay men, there are two different populations, but ultimately in the early 80s when it first started, those populations were the ones that had it. And it was because they realized like it was from the male to male interactions, as well as drug users. And it was like 94% male to male sexual contact and then 6% drug users.
Right.
And it started in New York and San Francisco.
In areas where they had very vibrant LGBTQ communities.
Yes. Very vibrant. It was much more progressive in that time, in those communities. Now it's vastly different even in there, but that's where it first started. And then it just kind of, it got really rampant and started to spread throughout the community, and people didn't know what was happening. And at that point, I think I want to say like the life expectancy for someone who did get HIV was like 11 months.
Yeah.
And I do want to clarify really quickly the difference between HIV and AIDS. So HIV is a human immunodeficient virus. I may be messing that up. But HIV is the actual virus that you get. Once and HIV is the virus will. I'm trying to make it educational. I don't want to use real a big terminology.
No, you can.
But HIV, it breaks down your helper T cells, so your immune system doesn't work to its full capacity.
Right. And
the virus itself will replicate and evolve in your body.
Right.
And when it gets to a certain point, it's called your viral load. And so when you get to a certain point over a certain number, you are then classified as having AIDS.
Right.
Because that's when it gets really bad. So you can get a common cold,
right,
and you will pass away,
right,
because your immune system is so bad at that point. And so that's why back in the day, they didn't understand, they did not understand why these individuals, men mostly, why those individuals were dying really quickly. And you see there are movies now and shows where you can see how they looked, and they lost a ton of weight and they had sores on their body. It was horrific.
What should have happened was the reaction that we had to COVID and the way that the entire healthcare system mobilized to find remedies to help it.
Right. Because for COVID, it took a year.
It took a year
for a vaccine.
Right. And I know that they used, because of the way that the virus, because it was a virus, there was a lot of already studies they used for the HIV to actually get to this point, right?
Correct.
Or to find out, but
to make it faster.
Right.
Now for COVID. Yeah.
Right. But at the time, the government wasn't talking about it.
Yep.
The Reagan administration at the time was not talking about it. Most state governments weren't talking about it because it was affecting a community that they didn't give a shit about.
Right.
And so it completely destroyed our community. We lost so many people that we can't even, you can't even begin to count how the value that we lost with individuals in our communities. And it's such a huge part of the gay community that I think we oftentimes take for granted. I think, I think I've talked about this before, but I think I'm the only thing that separates me from the generation before me that was devastated by HIV and AIDS is luck. I think I'm just lucky to be born in the age that I'm born in. I'm not conducting myself that's any less risky, or I'm not whatever that means, right? That's the medical term,
right?
But I'm not more. What I am though is I have more access that they didn't have,
correct? And
the things that they fought for, that's why they did it. It's like, and that's why I'm so grateful for the generations that came before us, because they were. There was a stat that you found about the year that we were born.
Yeah. So in 1992.
What year were you born?
I know. No, in 1992, the year we were born, AIDS was the number one cause of death for men between the ages of 25 and 44.
Yeah. Wow.
That is wild.
And we had an entire government, an entire healthcare system that part of it wasn't there, was acting like it didn't exist.
Yeah.
Yeah.
And to your point earlier, as far as like the COVID vaccine, it took a year. For back then, I think it took
20 years. I'm saying from
for like the actual drug.
Let's say we count 1981, and then the first drugs, because that's another part I wanted to talk about specifically were the drugs, because there were a lot of trial drugs or drugs that like AZT was a drug that and it ended up not being it wasn't even
it was at the expense of your kidneys. So like you could do it, but then like you could. Your kidneys could stop working.
Right.
I think it was.
And if it advanced at a certain level, it was already attacking your body in a different way.
Yeah.
Wow. So there was a lot of trial drugs that were being used at the time.
And that was like in the late 80s. I want to say like 87, the AZT.
Yeah.
But then ART. Ooh, I don't know, which is the antiretroviral treatment.
Mm-hmm.
I don't know when that started.
2001, but it was only for people who were already HIV positive, if I remember correctly.
Got it.
That's what it was. Because you can see, if you look at the death rates of, because once upon a time, not so long ago,
right?
An HIV positive test meant a death sentence.
Yep.
It was a death sentence.
Absolutely. Yeah.
And today it's not like that. And
it's not like that, but I will say there is that stigma that still lives around.
Oh, absolutely.
Yeah.
Absolutely. And it's because of all the treatments and stuff that we're sort of thankful that it doesn't have to be that way anymore. Yeah. But I think it was 2001. We can check that. But I think in 2001 is when they started figuring out like antiviral drugs that would prevent the virus from replicating itself in the body. And so it moved it from being more like a chronic condition, or moving from a death sentence to being more like a chronic condition.
Yeah.
And so it saved a lot of lives. And there were people who were diagnosed back when it was a death sentence, and things changed almost, within a year, right? It was like a whole process that changed and made it sort of easier for them and made them live. And I think now people with HIV, at least in the US, have around the same life expectancy as someone who is HIV negative.
Yeah. Someone who's healthy in the sense.
And those were,
I hate saying that, but like, living without HIV.
Right. And now they can be healthy, right? Like now they're in the space where they can
just as healthy.
Just as healthy.
Yeah.
If that means mortality, right? If that's the way you see things.
Right.
But another thing too is that, and then after that, came the preventative drugs, which when we became of age, I didn't know about PrEP, which stands for
pre-exposure prophylaxis.
Right.
Prophylaxis.
Yes, which means that
I should know this. But it basically means like it helps create antibodies to attack the virus before you're exposed. So there's pre-exposure prophylaxis,
right? And
then there's post-exposure prophylaxis,
right?
So it's PrEP and PEP,
right?
So those drugs actively help individuals, whether before PrEP, if they have an exposure, or if they have an exposure, a known exposure, they can take PEP within 24 to 48 hours, I think. No, 72 hours, I think. After exposure, and then they have to take PrEP, and that will help minimize their risk for contracting HIV
significantly.
Significantly.
PrEP is a 99%.
PrEP is a 99%.
Right.
PEP
Which doesn't mean, which what I'll say though, is I think a lot of people get this confused is when they hear 99%.
They're like, oh, but I could be that 1%.
Well, or they'll think that means I can have sex 100 times and one of the times will lead to me being HIV positive. No, it's a 99% chance of each chance that you're having sex, right?
Correct.
So each of those moments is a 99%.
Correct. And even then, I want to say
how many breakthrough cases? I think maybe 4. Yeah, there have only been 4 breakthrough cases in the history of the drug. So it changed the way that gay men saw our sex lives. Honestly,
right? It
changed the way that we see our sex lives and the way that we approached it. Because I think it was around 2011, 2012. I think in Texas when it became more accessible.
2012. Yeah, well, 2012 is when FDA approved it.
Yeah, and so that was almost 30 years after it had started. After it started.
So literally took
30 years. And so you'll hear a lot of gay men talk about being on PrEP, which is, for me, it's about having control of your sexual health because you're able to protect yourself in a way that you couldn't before.
Yeah.
And it's actually stopping the spread, which is actually what we want to do.
Correct.
And what we're aiming for. And I think a lot of people in the straight world just sort of don't understand that and what we went through. But when was the first time you ever heard about HIV or AIDS?
That is a fantastic question. I remember hearing about it in college for sure.
For the first time?
For the first time. Mm-hmm.
Wow.
I don't remember ever really hearing about it. Do I? No, I don't think I ever heard about it in high school or anything. Maybe I learned about it, but I learned about the virus.
Yeah.
Because I remember we took a health class and it was a semester. So maybe I learned about it then.
Yeah.
And I think that was 10th grade.
Yeah.
So maybe 10th grade. But I know for sure in college was when I realized the stigma around HIV as it related to being gay. Because that's also when I started to understand myself and who I was and finding myself. So I was a little bit more invested of understanding all of that too.
Yeah.
And just knowing what it all meant. And so I would say that's when I really learned about HIV.
Yeah.
But what about for you?
I was actually, while I was asking that question, I was trying to remember. And I think that I'd always heard about it and knew that it was a disease that was a death sentence. But I didn't understand the association and probably until much later. Until I started researching, what does this mean to be who I am?
Right.
And seeing the stories like that. And I think around that time too, around when we came out, a lot of movies came out that started talking about the topic differently and actually exploring it a lot more, because we didn't have shows like Pose, which brought us together originally, which talks about the epidemic. Or, even the Matthew McConaughey movie, Dallas Buyers Club. He won an Oscar for that.
Gosh. Yeah. And oh my God, that movie is amazing.
I love that movie. Yep. But we started seeing those later where it would kind of explain it, and it would talk about it being a death sentence. So when people see these in media, that's what they think all the time too. I remember something really in particular when I came out. My mom and I were getting a little bit more comfortable with having conversations about what it means to be gay, and my parents never talked to me about health. Or even did your parents ever had a sex talk with you?
I was literally about to ask you that. No.
Mine either.
Mine did not. We didn't have the birds and the bees.
Why?
I really don't know. I want to say it's because I was a man.
I think that's exactly why. Yeah. We should have said that in the machismo episode.
Right.
But
we're gonna cut this clip and include it last week's episode.
One of the first things my mom told me when I came out to her was, I just want you to be okay and I want you to be safe. And I knew in that moment that exactly what she was talking about. Yeah. And I don't blame her for that, because I knew in that moment that she was saying it from a place of love. Right. And she knew, I knew that it was ignorance. I knew that she didn't understand the full experience, but it's also not fair to say that wasn't the reality of what was happening in the world, right? Of people who were gay men.
Right.
Right.
Because I can imagine going through life, when you're thinking about my parents at my age, when they were my age, it was the AIDS epidemic. Yeah. And so they heard nothing but that. Yeah. And now we hear all about
especially in places outside of the New Yorks, the LAs, the Chicagos. Right. You're not hearing a lot of it. All you're hearing is this disease is attacking this community and it's happening over there.
We're safe.
It's not to say it's not happening here.
Do you know where the highest rates are today?
No.
In the South.
Oh yeah. Because of all the things that we've talked about on this show.
Right.
Yeah.
All the things. And then also that's not to say also, you know, like just, I think the cultures or the inclusivity is just a little bit higher.
Yeah.
In those places like New York and San Francisco. And like, so there's a little bit more understanding and I want to say acceptance of, but like, I mean that in like wanting to learn about it and know how to approach it and know how to have these conversations about what does it mean? What do all these things mean? And even as you mentioned earlier, like the Hispanic population, I think it was between 2018 and 2022.
That's the last time they've done.
That's the last time they've done the study.
Yeah.
For Hispanics, it went up 20% in men.
That
everyone else minus native,
indigenous and native.
No, Hawaiian and Pacific Islanders, they went up higher than Hispanics. I think it was like 32. But for Hispanic, and these are men. So Hispanic men, the HIV prevalence rate went up 20%.
And some of those studies might not be happening, right?
Not anymore.
So we won't,
I can guarantee you as of this year.
We won't even know.
We won't. I can guarantee you as of this year. I know this because we got a grant for the 2020, I think it's 2020, HIV or ending the HIV epidemic, which was started during the Biden administration. Not to get too much political, but now that grant that we have for Apollo is now built into our main grant. So what that means is like all of the requirements and everything that is as it had to relate to HIV is gone.
Right.
We can use that money if we wanted to. We can use that money for opening a different clinic
and the importance
to allergies.
And the importance of mandating is so that they focus on the things that are important in these spaces.
Right.
Which is what I was talking about earlier about mandating these policies. But do you get, when you were younger, do you remember your first HIV test? After you were out? Not after you were out, but after you had MSM? I remember it.
I do. It's not vivid.
I remember mine vividly.
I don't. I remember something else vividly, but
it's not even that sort of remarkable. It was just in DC. It was at a clinic, and it was like they do the 15 minute.
Yes.
They do the 15 minute. And most places in at least urban areas, you can get an HIV test for free. If the funding is there,
right?
Because most of those folks, and I think I saw a news article recently in San Antonio, how the San Antonio AIDS Foundation was talking about that, how they're not able to test people who are not having sex with men. They can't test the general population because their grants are eliminated because of that. Or you told me that, maybe one of the two.
Yeah, probably both. Yeah, because I know we had to like make some adjustments as far as like where the money was coming from.
Yeah,
like we could the wording was literally like the money, the federal dollars coming in cannot be used for HIV tests.
That's wild.
Like literally.
And it doesn't do anything. It doesn't help. It doesn't help the general.
What are you doing?
All it's doing is hurting. All it would do is hurt the general population. And we talked about this in previous episodes. The things that we're talking about, they affect us, but the consequences of it affect everybody. They affect everybody, and that just the healthcare system in general. And so on that though, I remember my first one and being so nervous, and I still to this day I still get nervous when I get an HIV test because of the anxiety, the HIV anxiety that I have.
I think and from the history.
It's just, and I know that the probability is much lower now for me in general. And I remember when my very first HIV test was just like, oh my gosh, this is it. Because I thought it was like, all right, because I think a lot of people, if I don't know, then I won't.
Then it's not there.
Then I'm good, and it's not there, and that's just not so true. Much is cool. That's not true. Yeah. But what was your story?
I think so. To answer your question, I really don't. I remember it being at university, like at the clinic on campus. But it was just kind of just like, okay, I'm going in.
Yeah.
And things of that nature. But I remember
we should get tested together.
We should do it. I know a place.
Oh, we should. Just like no, but like a quick one. You know, they just like walk into the trailers.
Oh yeah.
You know what? It's really cool one time because I the way that I feel about Stigma. I don't know if my husband's okay with me saying this. I'm gonna say it anyway. That was one of our first dates. Was to get tested together.
I love that.
I was like, I want this to be intentional. Let's go get tested together.
Oh, I love that.
Yeah.
That's interesting.
Yeah.
And because
it removes stigmas. It makes you start talking
from the beginning.
Yeah. It makes you start talking about these things because it's important.
Right. You want to enter into it.
Talking about families though, just kind of skipping around everywhere, was that I remember the relief on my mom's face when I told her, about 10 years ago when I first got on it, that I was on PrEP. I remember the relief in her face when I explained it to her and said,
what it does.
and said, this means that I have almost a non-existent chance of contracting HIV. Correct. And I remember my mom's being like, oh, wow. Is that, and she would ask me even after that, like, are you still on it? Are you keeping up with it? And it actually comforted me. It made me feel so good that she was understanding and asking me about it.
Oh, like I love that. And that's I'm sure as a parent it's comforting because I mean obviously you want your children to be healthy,
right?
And at the end of the day, like going back to how our parents grew up, like it's probably I know that's where it's from. Mm-hmm. It's never that as far as like with what your mom mentioned to you as far as like I just want you to be safe, right? It's coming from a very loving place, but I completely get that, right? And I will say going back to earlier when I was. Something that happened early on for me was actually I was living in New York for an internship, and then Roger and I had just started dating. This was back in 2012, and I made him go get a test, and I was like, I'm not even there, but go get a test.
What do you mean?
I thought it was interesting because I remember at that point we were early dating. We were like maybe 2 months in, and then we started talking about like past relationships and past experiences and things of that nature.
You were talking about exclusivity at that point, is that why?
Yes. And then I was like, oh, you need to go get tested before I see you again. Yeah. I kind of felt bad, but
you wanted to
I wanted a what, Kendrick? I wanted a what?
He's like, before I let you take me down, I need to make sure that this is good.
Yeah. Basically.
That's smart though. That's what we should be doing.
Yeah, it's because at that point we were obviously still getting to know one another and learn about our past and everything.
I would have asked you. I need you to go get one right now.
You said your face is pretty. You must have a high body count.
You must have a high body count. So go get tested. Go get tested right now. But I think it's important why we wanted to talk about this specifically is because gay men don't talk about this. They want to talk about sex a lot, but don't want to talk about the safety and the preventative measures that you can be taking to make your sex life even better.
And there's so right. I was going
to say, be careful
right now in this moment. There are accessible ways to getting PrEP still.
Can I challenge you on that?
Go for it.
I'm not sure that that's the same way for all populations. And what I mean by that, the access might be there, but I'm saying the awareness might not be there. Well, and that's what you do. So you know this.
It's because of the marketing aspect.
Right.
Yeah. No. Right. Oh, absolutely. And the marketing, and that's not on the patient side at all.
Right.
That's on the
and that's what I mean. Like even
side,
I do think the amount of immigrants that I know that are gay here in San Antonio that are actually on it means that they're actually doing something right in some spaces. Right. So there are some spaces here in San Antonio where they're doing that right because if it doesn't matter if you are documented, undocumented immigrant, it doesn't matter. We have to stop the spread everywhere for it to stop, in our communities.
Yeah. Period.
Hey everyone, just a quick reminder, if you're watching, don't forget to like the video. And if you're listening, leaving us a review goes a long way. But honestly, the biggest way you've helped us grow so far is by sharing the show. So if you're loving it, send it to someone that you think would love it too. Now back to the show. Okay, so the next thing I wanted to talk about was just, we went a lot into what HIV meant for our community. And I think it was important because HIV has shaped healthcare for the gay community in a big way.
A lot. Mm-hmm.
But the healthcare of our community today is much more than just one disease.
Right.
And so I wanted to talk to you about that, about how you handle your own personal health. Are you someone who goes to the doctor easily?
I am.
Yeah.
I think even thinking about it, like, growing up, my mom was absolutely the type that would be like, you don't feel well? Let's go to the doctor.
Oh, good.
Like she definitely broke that stereotype. Yeah. Because I feel like sometimes in the Latino community, you're like, oh, we'll wait.
Or, my mom waits. When we were younger, she waited. I probably never told you this story, but she wanted me to wait until the morning for I had fallen and hurt my pinky, which is why it's crooked like that. See it? I had hurt my pinky and it ended up being broken. I had to cry enough so she was like, oh shit, something's wrong.
But I'm sorry, I did not mean to laugh.
You can laugh, but you know what that is though? You know what that is though? That is more of a money thing and access to care.
Oh,
because my mom knew that if she took me to the emergency room rather than taking me to a primary care physician, it would be a lot. It would be a lot more. Yeah. And she knew I wasn't dying. I mean, my finger was broken, and it's chueco because of that. But
your finger was just facing the opposite way,
right?
But you were okay,
right?
You just had to cry.
And so I remember that. No. But now my parents are much more health conscious. I think my mom works in a hospital setting now. My brother is in the medical field.
Yeah.
So I think that helps things.
Yeah.
And my dad has kind of always been a little bit more health conscious than my mom.
Interesting.
My dad will go to the doctor as soon as he feels any kind of ailment.
Oh, I love that.
Oh yeah.
Oh my God. Like,
yeah. I mean, he's always sick, but
I feel like the more we talk, I'm like, damn, our parents really, both of our parents, like broke a lot of stereotypes actually growing up.
Which is why we're probably able to do this.
Right.
And not a toxic way.
Right.
It's not a reaction, not a toxic way. What am I trying to, I don't even know what I'm trying to say, but in a way that doesn't feel like we're lashing out on that.
Right.
We've lashed out.
We're able to.
We would go back to body image.
Go back to mental health.
Your mom was like, he said I did something good? Ooh, child. Ooh, your mom was like, what is this,
she's
honey?
like, oh, no.
She's like, I came for the tea. I'm going to turn this off.
Right. She's like, let me actually turn it on. But yeah, my mom was definitely the one that took us. Like, we never missed a physical. If we were sick, we would go. Like, we also went to like the same doctor. Like, she knew, weirdly, because she didn't work in healthcare, but she knew like the continuity of care, like what that meant. And by that, what I mean by that is also like going to the same location, not necessarily the same doctor, but like somewhere where they know exactly what has happened, where they have your full medical records. Because like I went to the same doctor all 18 years of my growing up.
Wow.
Like it was one doctor the entire time.
But mental health wasn't healthcare. No, I'm asking you.
Nope.
In her mind, mental health, it was physical health.
It was physical health. It was physical. The anxiety piece or mental health in general wasn't a thing. Like never talked about it. Yeah. But like dentists.
Oh, my mom was consistent about the dentist.
Yeah.
And we had one, almost like, I think it was like one dentist office in all of West Texas, maybe one or two. And I remember we used to sit, we would be in the waiting room for like 3 hours. That's how, because they were just so far behind, always. It was the worst. I don't know why we did that. It made me hate the dentist when I was growing up.
Oh, I would hate healthcare in general.
Yeah. Like waiting 3 hours just to
Oh, absolutely not.
And they were always behind. I'm like, why? Did they not have Yelp back then? Like, was no
Girl,
one...
they barely had the internet.
Was no one saying anything to this?
They had Google reviews.
Yeah, it was just like a whole thing. But
damn.
Yeah. But anyway, what about now? So now you are very health conscious.
So now I'm very health conscious in a lot of aspects. And, like I do care about, what I eat. I care about working out. I care about like being active more so. I remember my husband.
I was going to say, you're married to Dr. Roger.
Now... I don't know. He like early on, I had to like push him to be like, hey, do you want to go work out? Do you want to go run? Do you want to do something?
No. I'm talking about that. I'm talking about like
being
Mr. WebMD.
He stay on WebMD.
Roger would diagnose you.
He's chat GTP on the medical side.
Right.
For me, for you, for your husband.
He's like, no, I think this is what's going on with you. Especially if it's like anything that is like ENT related.
Yes.
He like if it's like strep or like flu or like he's like, no, that's a flu symptom. That's not COVID.
Right. And what I really appreciate about him actually is how hard he is on his parents.
As he should be, as we all should be.
Right. Not thankfully. I guess I'm just I don't know. I don't even want to say lucky, but I don't have to do that for my mom.
Yeah.
Because I know like she has it covered.
Right.
Like my mom takes no medicines.
Yeah.
And I find that like wildly insane.
Yeah. My mom was supposed to take certain medicines like for like high blood pressure and other things.
Right.
And like dieted her way out of it. Which
That's
is like,
how my mom is.
It's okay to do that.
Right.
But it was a fear of being on medicine, which is the problem.
It wasn't like she didn't want to be healthy. She wanted to be off of medicine.
She did, but she didn't want to be in that classified area of like being pre-diabetic or being diabetic.
Interesting.
Yeah. Whatever it takes.
Right. At this point, I'm like, Mom, no.
Whatever it takes.
Whatever it takes. What do you need?
Do you have health anxiety though?
In the sense of like being worried if I am going to be having something? Not necessarily.
Okay.
I think because I do understand more than the general public of knowing what is available. Mm-hmm. And I am very privileged to say I have high accessibility to healthcare.
Yeah.
Because of my job, because of my health insurance status. because of just my general knowledge sometimes,
Right.
all of that. I know I'm very privileged in that sense. So
Right.
I think that helps me not have health anxiety, because like I know cholesterol, blood pressure, hypertension, and then diabetes all run in my family.
Yeah.
So like,
but we're Latinos. Doesn't that run in everybody's family?
yes. Yeah. Well, it's weird because like my mom's side is the diabetics, and then my dad's side has the high cholesterol and high or hypertension.
Yeah.
So
I think that might be the same. It's hard for me though, because I've talked about it in previous episodes how I'm on ADHD medications.
Right.
And all of those, especially men of color, help your blood pressure up.
Yeah.
So recently I've been feeling kind of off, and my psychiatrist was like, we need to watch these things, and here's, a beta blocker to kind of help you in this way.
Yeah.
But it's been really interesting to see that. Do you consider me health conscious?
Very.
Why?
I think because you are aware.
Yeah.
Even as I think it stems from my perspective. Like you're very health conscious in your mental health.
Yeah.
And I've noticed that obviously because like you helped me. And so with that, I
track my every heartbeat.
Yeah. The way he'll be like, Bessie, look at this. My sleep. That's also another thing. Like with my watch, I don't think Roger actually helped me with this too, but like, I never used to sleep with my watch, but now I'm like, I want to know how I'm sleeping.
I told both of y'all.
And now I'm here like,
you need to know where
I
you're
get
sleeping.
10 minutes of deep sleep at night. 30 if I'm lucky.
Gosh. That's why you can't read.
I can't what?
That's why you can't read.
Says the one who only reads audiobooks.
Is that why you're dumb? Because you're not getting deep sleep?
That's why I'm always tired.
I'm very health conscious though about everything. Like, so for those of you who don't know, I'm not going to give them a free promotion, but I wear a ring that tracks my sleep, and I'm always looking at my indicators to see how because it shows how my physiological stresses are. Yeah. And sometimes that can be associated to other stresses that are happening in your body. And so I love this thing. This thing told me I had COVID 2 days before.
Damn.
I mean, it told me I was sick because it tracked my body heat and everything. Yeah. And so I knew. And it also helped me, be aware. I think recently when the show first started, I started getting really sick, and my ring told me I was getting sick, and I was able to stop it. I was usually I was like, oh, go sweat it out in the gym. And like, I was reading their sort of like AI function, and they're like, that's actually the worst thing you can do when you're feeling bad.
is go work
out. Your body has to be able to fight it.
Rest.
Yeah. It has to be able to rest. It has to rest and fight it. So these weren't things that I was taught, but I wasn't like not taught these things. I wasn't like, my parents were never, they also knew like fever means a problem. So they weren't, if I had a fever, they weren't going to like stop, not take me. It wasn't like, let's throw Vicks on you and make sure you're good to go. Like,
oh my gosh. Let's talk about Vicks real quick.
Why? What do you want to say?
Well, because like, I just feel like growing up, that is probably the one like cultural, Latino culture thing that happened to me that was like thrown upon me of like,
besides your birthright of being a proud Latino. What the hell? I'm gonna cancel this show. Yeah, I promise he doesn't hate himself. What's wrong with you?
I loved it though, because Vicks would
Who did it for you,
everything. And, my dad did, like basically everyone on my dad's side.
Yeah.
Like
it
Vicks
works though in certain situations.
Vicks cure everything. Like that was one like healthcare myth that I learned early on.
Yeah.
That Vicks worked for everything. Like, your toe hurts?
Yeah.
Put some Vicks on it.
Oh my gosh. But yeah, so I think it's important for us, especially as we're getting older, but no matter the age you are, that you're, especially as gay men, especially as gay Latino men, that you are at least health aware and aware of what your body's, the things that are happening within your body and genetics, the things that happen because that you're predisposed to. To make sure that you're good to go.
Yeah, especially because of like the genetics aspect. There are ways to help prevent those still. Like,
absolutely.
Even though you are I don't know if people recognize that or if they're just like, sometimes I've seen it being done where they're like, well, I'm going to get it anyway, so might as well.
No, absolutely not.
Eat whatever I want, drink whatever. Like, there are things that you can do to prevent it. And I'm lucky to work. I will say, like, I love where I work because I know we have so many, it's not just about like, the patient goes to the doctor and then goes home. Yeah. Like that is not our model. Like we have coaches that are complimentary for all of our patients. We prioritize those are higher risk. So like if they have higher risk, they have access to coaches, nutritionists. We have quality individuals that specifically focus on making sure that the health metrics of everyone at our clinic are going up. And if they're going down, we try to figure out what is happening because we're like, no, this is not it. But I'm glad that we have that, and we have each other too, to like kind of like check in on one another, especially as it relates to our health. And we do it constantly, but like we also check one another if we're like, oh no, I'm fine. And then we're like, go to the doctor. Like it's okay to be sick.
I have a question for you.
Yeah.
What if I was gaining weight in a way that was becoming unhealthy? Would you tell me something?
I would, but there is definitely the way I would tell. I would have to approach it in a way that I know is gonna work.
Yeah.
Like I'm not gonna just be like, dude, you're gaining weight. I would never do that.
Yeah.
I don't even know why I said dude, but
I was gonna say that was the first mistake. When have you ever said dude? You'd be like, bitch. So you wouldn't tell me anything?
No, I would. If I knew,
I can't wait to tell you.
And then I'm just gonna show you the body image episode. Remember this? But no, because I
would never tell you.
Really?
And let me tell you why.
What if I was actively doing something?
What do you mean?
Like, what if I was like, like you knew I wasn't eating well anymore. You knew I was doing.
I would ask you how you're doing.
I think that's my approach.
But the reason why I wouldn't say anything is because of where you are, and I know that you would obviously be like on it.
I know. It's kind of, I feel like it's a reach to ask one another that, because I feel like we would realize that ourselves first.
Right.
So I don't even think we would get to that point.
Right.
But I would always want you to be healthy. And I think that's where I would want to come from. Like if I recognize something, whether it's weight or whether it's something else.
Or you were looking more tired and you're like, you would tell me like, I know how much you prioritize sleep. What is going on?
Right. Like if you look tired,
right.
I'm like, girl, I know you get an hour and a half of deep sleep and me 10 minutes.
Yep. But you see, that's what happens. So you have to prioritize your sleep. And this is an hour and a half of deep sleep, and that is 5 minutes of deep sleep. So
put in the comments below who looks better.
You pick your poison.
I'm just kidding. Don't.
Go ahead.
Don't.
Go ahead. We can do that. But anyway. So one thing I wanted to talk about, we talk a lot about on this show coming out and how it never stops.
Oh God.
We also have to come out at the doctor's office.
All the time.
Yeah. And it's something that is really important that we talk about, because it is sometimes really embarrassing, not because of I'm embarrassed of being gay, but because doctors sometimes don't know how to handle it.
A lot of the time.
And don't know how to like be in those situations. So you talked about this before, but I want you to tell the story about, what's happened to you and those experiences. I guess I can start with me first. I'll start a story that I have.
Oh, yeah.
Of my husband had Bell's palsy, which gives you sort of a paralysis on the side of your face that can be temporary, or it can, last a really long time. Yeah. And so I remember when we went to the doctor for that, and I didn't know the difference. And so my concern immediately was, let me make sure he's not having a stroke. And we were in the emergency room, and we went to urgent care first, and they said, we can't make sure here. So you need to take him to an emergency room.
Yeah.
So I went to the emergency room, and I was back there helping him. And he, obviously was feeling really bad about himself, because it's scary. You don't feel half of your face.
Oh my gosh.
And I remember the doctor asking me while I was in there of saying like, are you his brother? And I said, no, that's my boyfriend. And looking at the nurse and say, all right, let's order an HIV test. And those two things, the association, as if that wouldn't have been a part of their normal tests, right? As if that wouldn't have been a normal part of the tests that they're doing.
Right.
But they have to understand what that does to people and what that makes them think. And so something that I do, when I go to urgent care, I don't like I'm on PrEP, which is the medication. I don't disclose that at urgent care, and I know how bad that is. You're supposed to disclose all your medicines, so they make sure that you're good
at that point.
But for me, I think it clouds their judgment.
Which I being brutally honest, I think you're right.
Yeah. And so I'm like, you know what? I know that I'm good. I know that I'm going to be good with this. If it's something that's maybe associated, I think there are some forms of PrEP that can be harder on certain parts of your body than others.
Correct.
And so if it's something that's associated in that space, I do my own research on the side. I'm not a doctor, but I do my own research on the side to say, let me make sure I even want to have this conversation, because sometimes they'll stop actually treating me and what's really wrong with me.
And they'll focus on something.
And that happened one time. I was in the emergency room. I got E. coli. And so were we friends recently?
Yes.
You told me about this because you told me to reach out, and I did. You told me to reach out to the medical, to the was it like a medical board?
For that one nurse?
There was a nurse in there that said that I was telling her all my symptoms and they couldn't figure out what it was. It ended up being, they did a culture and figured out that I had E. coli. But she was like, wow. she was like, well, when was the last time you had HIV? And then when was the last time you've been tested for HIV?
Oh, I was like, wait, what?
She said that. When was the last time you were tested for HIV? Immediately. And then she said, what did she say? It was something she said that really kind of set me off in that
just
moment.
Like wrong.
Yes. I think she said something, I don't remember what it was, but she said something that was like, oh, you really don't know what you're talking about in this space. And, just in asking me a bunch of questions like about how many partners you've had. And that's okay if it's health related, if those things are associated.
For like an STI.
Right. If I'm going for an STI or then it's okay to ask those things, but to just, you can tell. And I think as gay men, we have that indicator in our mind and we can always tell. You and I know better to fight through the system, but some people would just leave or not go.
Right. Yes. Like very similarly, as I mentioned a couple episodes back, on the work episode, actually, like when I went to the doctor one time, and the doctor like told me he was going to order me an HIV test because I had a boyfriend. Similar to your husband. I'm like, are you joking?
Right.
I was like, I picked him also because he was a person of color.
Right.
Like
we started the show to let you know the people of color are the worst ones.
Don't trust no hope.
Don't trust nobody. Hey, be your own people at the time.
Right,
all your skin folk is not your kinfolk.
I have never heard that.
I got that from Angela Rye. Do you know who that is?
No.
She's an amazing sort of like activist. Like she has her own podcast. She's a commentator on CNN sometimes. I love her, but she says that not all your skin folk is not your kinfolk.
I love it. I'm here for it. But yeah, like we definitely know better than to just be like, we're not going to go back. I will find a new route.
Right.
I'm gonna find a new route because it's just beyond me just to know, or I really just wish the system was better as it relates to that and the cultural competency. Doctors are physicians in general, are practitioners, I will say better, are under so much stress already of like trying to diagnose and trying to get things right. And even then there's like a percentage that they're not, and that's always going to be the case. But like, as it relates to going through school, there is, from my understanding, there is no requirement to understand the culture as it relates to LGBTQ. Very few.
Yeah, and I think it started a lot. A lot of what we experience in the medical field is a part of our LGBTQ history, and what I mean by that is that Oberfeld, which was the decision that overturned marriage, actually evolved from, or it came from a partner who didn't have access to his partner when he was chronically ill, and his parents kept him out of the room. It's actually one of the reasons why my husband wanted to get married. When we first started getting serious about wanting to be married, I don't know if I've ever told you this.
No, I didn't know this.
When we got really serious about getting married, he asked me and found out that if he was chronically ill, or not chronically ill, if he was what am I trying to say? Like he was unable to speak for himself.
Unconscious.
Right.
Or, I know what you're saying.
If he was, what am I trying to say? If he was unable to,
not of mind is like,
anyway, if he was unable to make his own decisions about his health, he didn't realize that his family could prevent me from being around him.
Yeah.
And the moment that he realized that, it almost was like a ticking time bomb in his brain. Not that anything has happened, or thank God nothing has happened.
Yeah.
But in his mind, he was like, "Oh my gosh, I've got to figure out, because that just can't happen." And of course, there are other things you can do. Power of attorney. It's not the reason to get married,
right?
But so that's what happened in that case. Is in the healthcare system, they're not known to ask us. Like even when I go in with my husband, they're like, "Are you a friend?" or like, "What are you?" And I'm like, "What? Why do you ask people this if they're like married?" And maybe they do, but you can always tell when they're asking you that it's coming from a different place.
Right. It's there, and there is a easy way to like just standardize it.
Yeah.
What is the relation between the two of you?
Yeah.
You can ask it to you can ask it to us. You can ask it to you and your husband. Me and my husband. A married heterosexual couple. Like they're like things like that.
Yeah.
It's those little things that providers sometimes don't understand. Providers, practitioners, anybody in the clinical space, like Sometimes
also
they just don't understand it.
It's also why affirming care is so important. And what we mean by affirming care is just going to healthcare where you know you're going to be validated for who you are.
Yep.
And in those spaces, which is why I love that you had created Apollo, because that's what Apollo did. Is it created a space for me and a space in San Antonio where other gay men like me could go and actually, talk about their healthcare in a way that doesn't feel like they're being judged. It doesn't come with the stigmas. And of course, they're always learning too. I think they tell me all the time, we're always learning. We're trying to figure out what's the best way to adjust to patients, which is what they should be doing.
Yeah. And even then, like we were very intentional. I know I say intentionality, I will say was absolutely like key as it related to Apollo, but like, because like we wanted a practitioner where an individual, like either of us, we can go in and we can talk about being a bottom or being a top or being first. And the practitioner is going to know what we're talking about. Yeah. That doesn't happen usually in healthcare, but we knew specifically, like we wanted, no matter the community, we want the practitioner to understand, meet the patient where they're at and not the other way around. Yeah. Where usually it's like that, where like the patient has to go to, or has to meet the provider at where they're at. Yeah. And it's like, no, like, you're not going to tell them, a specific drug. You're not going to give the drug name. Yeah. They're going to be like, what the hell is that? Yeah.
So as we've said in a lot of episodes before, we're going to spend a lot of time on these topics as we continue to evolve it. But we wanted to sort of start with this because it's just it's a big part of like the rest of these episodes, foundation to who we are and what we do. Do you want to roll into Don't Piss Me Off?
Yeah, let's do it.
So for me, Don't Piss Me Off, this is something in the gay community that drives me crazy. And a lot of times in the gay community, you'll have people ask if you're clean. What do I mean by that? They'll say that by you saying that you're clean, that means that you don't have HIV or any other STD. First of all, people who have HIV are not dirty. They're not dirty.
They're not.
And it doesn't mean there's another way to ask that. Hey, I want to understand. And you should be asking your partner status, right? Correct. If you're going to engage in activity with someone, it is okay to ask their status. Correct. But to go around on apps or in person saying I'm clean or asking someone if they're clean is ridiculous. Like we're falling into the stigmas that got us in a really dark place in the 80s. And when people continue to do that, it drives me crazy. Someone who has HIV is HIV positive is not dirty. And so we need to get rid of these terms that call someone dirty or clean if they have a certain status on HIV. Drives me crazy.
Yeah. Oh, I like that. Because I feel like that happens a lot. Like even in the healthcare space.
They use the word clean.
I've heard it before. Oh, I've heard it before. And I'm like, granted, it's been a couple, it was when I was in Houston.
Yeah, I think we're learning.
I was like, you don't say that.
Right. Right. Especially because I think now something we didn't mention is that, someone who is the way that care works now with someone who is HIV positive is to have them reach a level of being undetectable. Correct. What that means is that you can't detect the disease in their body. And usually most tests won't identify it, right? Unless they're off medication.
As far as,
if they're detectable or not.
Right. There is a specific test.
And so one other thing about making sure that people who have HIV remain undetectable is that means that they can't transmit the disease. Yeah. So you scientifically cannot get HIV from someone who is undetectable. Right. Now, the best thing you can do is everybody be responsible for your own care. So making sure that, if I'm on PrEP, then I know I'm taking care of myself and making sure that you're having these discussions with your partners so that they're taking care of themselves as well. Yeah. If they have access and because access is a big issue. I know awareness and access are obviously a huge issue in our community, but it's why it's important that we start talking about these things. We've got to talk about sex in this community and not in the way that is talking about like our sex exploits, right? Or it's like it's about talking about the safety that comes with it and the way that we can take care of ourselves, because that's the way we're going to stop this disease that obliterated. And I hate using that word.
It did,
but it decimated so many of our loved ones in our ancestors in this community.
Yeah. And I will say, we usually do say living with HIV just because like they're living. Yeah. Like HIV is no longer the death
as opposed
sentence.
To what? Are you correct?
HIV positive.
Ah, okay.
Just because like they're living with HIV. Oh, I think it's a transition of HIV positive is not necessarily wrong. Right. But living with HIV, it gives that idea like they have a healthy life because they're living with it.
On that point, though, it is wrong if they're undetectable because they wouldn't be HIV positive, would they?
Oh, that is true. Yeah, they're living with. we have transitioned, and that's more newer. But we have transitioned to saying
you can say change your freaking language. You're not saying it right. That's okay. We're all learning.
But it's a learning experience. It's a learning moment for us. But for me, don't piss me off. Just because somebody's on PrEP does not mean that they're having more sex.
Oh,
I think there is so much, like, we're trying to break stereotypes and stigma as it relates to HIV in general. Why are we doing this again?
It's weird.
It's like we're doing it all over, because then people that don't have sex that often, but they have multiple partners still, they should still have PrEP. They should still be on PrEP, especially if the point is to reduce the spread of HIV.
Right.
Ultimately to eliminate it.
Right.
But if people are dogging one another in the gay community of being like,
they are,
oh, you're on PrEP.
Well, you're raw dogging. Will you let me keep that in there?
Now you adding to it.
Will you let me keep that in there?
Yeah, but it's like that. Like, I feel like a lot of people, they're like, oh, you're on PrEP. Like
but it. And I see it a lot on social media of like, I saw one person, he said he was joking, but he said that like a red flag, if they're on PrEP, that's a green flag.
That's like multiple green flags.
They are taking care of themselves. They know is that the right language? I don't even know if that's the right language, but they're sexually aware.
Yeah, they know themselves.
And I think another misconception, which my primary care physician talked to me about, or taught me about, was that a lot of people think that because people are on PrEP that they're more likely to have other disease because they're less, the use of condoms is a lot less. And that's actually factually incorrect.
It's on its head.
Yeah, the statistics are actually showing that those people, because they are getting tested more often, are much more aware and much more conscious about these things, that they're willing to have conversations with their sexual partners to, have these discussions and make sure that they are, taking care of themselves.
Or they're on Doxy.
Right.
Which is also another drug.
We didn't talk about Doxy.
We didn't. DoxyPep. DoxyPep is doxycycline. It's a common drug for...
It's a common antibiotic hang on. It's a common antibiotic for people who are resistant to like penicillin, but it can be used for a lot of things.
Yeah, like acne is one of the things that I know.
I think it's like acne, UTIs. It's like a bunch of...
There's a lot. But then it's also been statistically proven that it reduces the likelihood of getting gonorrhea, chlamydia, or syphilis.
Correct.
After a potential exposure.
Right.
So if you have an exposure, then you take DoxyPep afterwards, and it limits it reduces the chances.
It was always hard when I was younger, now I get it when I'm older. When you say exposure, you just mean if you have a behavior where it can spread, right?
Correct.
Because when I was younger, I was like, how am I supposed to know I'm exposed?
Yeah, no,
you know what I mean?
Yeah,
I think that that there's a divide between the science or the medical language and actually what people experience or what they're going through.
Right.
Because when I was younger, I was like, I've been exposed to HIV. How do I know if I've been exposed to HIV?
Yeah. I guess so. Yeah, maybe it's not necessarily. I think exposure probably is wrong. Actually, it's more of an encounter. Like when you have an encounter, because you don't know. You don't know if you're exposed to HIV or syphilis, gonorrhea, any STI in general. So you take the preventative drugs.
And now we have the tools where we can actually protect ourselves in a way that we couldn't. And by protecting ourselves, we're stopping the spread.
Yeah.
And so that's how we're seeing our rates lower. But it's still important for us to talk about because the rates are going up in our communities.
They're going up, especially like, is it chlamydia, I think, in Bexar County, like most recently.
Oh.
Like chlamydia is going up. A lot of the STIs are increasing. But yeah, I think that the most important thing is to have a healthy conversation with your friends, with your partners, with your provider, being open about it, being open about who you are. Bring your full self to the doctor. I know that's hard to say. That is, I know that's hard, period. But the more open you are, maybe you're helping them too. You're helping them learn. And you're not there to help them learn, but they can. But I really enjoyed this episode.
Me too.
Just because like it's the world I live in. I'm really passionate about it. I love what I'm doing as it relates to everything. Yeah. Whether it's, we talked about in the gay culture, like HIV is a huge thing. We also talked some about the Latino culture and like having the pre-exposed, what is it called? We're predisposed to
a bunch of other things.
A bunch of other chronic and sometimes comorbidities that, you have multiple at a time. So I hope y'all learned something from today. I know there is so much that we could talk about health. I mean, health could be a whole season, I feel.
Yeah.
Like from access to insurance to, coding and all of it. Like there's just so much, but we wanted to, just kind of touch the very tip.
Yeah.
Healthcare is an iceberg.
Okay. I was going to say.
I had to transition that real quick.
Can you get STIs from just the tip? That is a real medical question, Jake. Can you get STIs from just the tip?
Yes. If it's uncovered.
What do you mean?
Oh. Without a condom.
Oh, I thought you were like, ooh, I'm about to take that real south.
You thought whether it was uncut or cut.
Oh my God.
I'm going to call you out.
All right. Well, we hope to see y'all next time on the JK But Gay Show. But thank you, everybody.